Hi, my name's Ellie. I'm the nurse practitioner that's going to be taking part in your care today. Can you go ahead and introduce yourself with your full name and date of birth?
Zachary Seach, December 23rd, 1993.
Okay. And why are you here today?
Annual checkup?
You identify as a male, correct?
Yes.
And your race?
Caucasian?
Any medical history that we need to be aware of?
Nope.
And any history of surgeries?
Nope.
Um, are you on any medications recently?
I am not.
Or in the past?
Nope.
Family history that's of note?
My one grandpa had heart problems. That's about it.
Okay. Any personal or social history we need to be aware of? Okay. So we're just gonna kind of go through, and you'll tell me a little bit about your body and if any changes are occurring throughout your systems. Okay.
All right.
So have you had any abnormal rashes or itching of your
Nope.
skin? Any color changes in the pigment of your skin?
Nope.
Have you had any increased sweating?
Nope.
Any abnormal hair or nail growth?
Nope.
Have you had any blurred vision, double vision, pain in your eyes, or visual changes?
Nope.
Are you currently on any medications for your vision?
I am not.
Any history of glaucoma or visual trauma?
None.
And no sensitivity to light?
Nope.
Okay. Have you had any recent headaches, dizziness, syncopal episodes, like you feel like you're going to pass out,
No.
or head injuries?
No.
Have you had any changes in your level of consciousness?
No.
Okay. Any recent hearing loss, pain, or discharge from your ears?
Nope.
Any ringing in your ears?
No.
Any recent ear infections?
Nope.
Have you had any changes in your smell?
No.
Any frequent colds or nasal obstructions?
Nope.
Okay. Have you had discharge or pain from your nose?
None.
Have you had any hoarseness or changes in your voice?
Nope.
Frequent sore throats or bleeding or swelling gums?
No.
Any tooth obstruction, abscesses or extractions? Any soreness or ulcers in your mouth?
No.
Have you had any taste changes recently?
Nope.
And do you get regular dental care?
Yes.
What do you do for your dental care?
I go for twice a month for cleanings.
Okay. Any lumps or tenderness around your neck or throat area?
Nope.
How about have you checked in your like armpit area for any lumps or tenderness?
Yeah, it seems fine there.
Have you had any recent chest pain, wheezing, abnormal coughing?
Nope.
Have you had any abnormal sputum, like your spit?
Nope.
Have you recently been exposed to anyone with tuberculosis?
Nope.
If you've had a recent chest x-ray, when was the most recent one?
About 2.5 years ago.
Okay. And nothing significant on that?
Nope.
Have you had any pain or swelling in your legs or arms?
Nope.
Any abnormal heart palpitations, like it feels like your heart's beating abnormally?
Nope.
Any shortness of breath?
Nope.
With or without exercise? And you tolerate exercise well?
Yes.
Okay. Have you ever had an echocardiogram? It's like a picture of your heart.
No.
Okay. Have you had any abnormal bruising or bleeding?
Nope.
And you have no diagnosed cell abnormalities?
No.
Have you been eating well?
Yes.
Okay. So your appetite's good, and you have regular bowel movements?
Yes.
No changes in consistency, like constipation or diarrhea?
No.
Okay. Do you have any food intolerances or allergies?
Nope.
After you eat, do you have any heartburn, nausea, or vomiting?
Nope.
Any trouble eating?
No.
You're able to chew and swallow your food well?
Yes.
Do you have any history of ulcers, polyps, or tumors
No.
that we need to be aware of? Or gallstones?
Nope.
Okay. Do you have any history of hemorrhoids?
No.
And any abnormal flatulence?
No.
Alrighty. So you said you're able to eat well and your appetite's good. What are the foods you typically tend to like?
Meat and potatoes, some vegetables, some fruits.
Anything you absolutely dislike?
No, not really.
Okay. And are you taking any vitamins or other supplements?
I take one a day vitamins, protein powder, and creatine.
Okay. And then do you drink any caffeine or any caffeine drinks?
Uh, Sometimes, not a whole lot.
Okay. And you said no swelling or redness around your neck or anything like that. Do you have any heat or cold intolerances?
No.
Any recent weight changes?
I lost a little bit of weight due to exercise.
But nothing abnormal.
Nothing yet.
Do you have any history of diabetes?
No.
You drink plenty of water in a day,
Yes.
but you don't feel like you overdrink?
No.
How much water would you say you drink in a day?
Probably a little less than a gallon, maybe.
Okay, good.
Around there.
And you urinate enough throughout the day,
Yes.
but not but to the point where you feel like it's excessive?
No.
Okay. When did you have puberty onset?
Probably around 12 or 13 years old.
Okay, and since then, no problems with erections?
No.
Any changes in your sex drive?
No.
Any testicular pain?
Nope.
And any infertility problems that you're aware of?
No.
Do you have any history of STDs?
Nope.
Pain on urination?
Nope.
With urination, any kind of urgency problems, frequency, or happen to urinate at night?
Nope.
No blood or discolored urine?
Nope.
And you feel like you empty your bladder completely. There's no like dribbling or anything like that.
Nope.
Do you have any joint pain or stiffness?
I do not.
Any restrictions to movement?
No.
Have you had any kind of swelling or redness in any of your joints or muscles?
Nope.
And no bone deformities?
Nope.
Okay. And you said no syncopal episodes. Have you had any history of seizures?
No.
Any weakness or paralysis?
Nope.
Any abnormal sensations or coordination problems?
Nope.
Any tremors?
No.
And you're able to remember well?
Yes.
Okay. And then any history of depression?
Nope.
Have you had any kind of mood changes like anxiety, agitation, or tension?
Not really.
Okay. Are you able to concentrate well?
Yeah.
And any kind of suicidal thoughts?
Nope.
And are you able to sleep well at night?
Yes.
Okay. Well, you did good. That's all I have for you today. Thank you.